Hi folks, this is Dr. Burke Mays with Pathways Integrative Health Center. Today we're on part number 2 of our 22-part journey into different reasons behind why low thyroid activity occurs, why people have poor thyroid health. And today we're going to talk about poor hypothalamus function due to dopamine deficiency. As talked about in earlier sections, the hypothalamus is a part of the brain, it's like the master control system for hormone production. And dopamine is a chemical we call a neurotransmitter that's made in your body to help your nervous system work. And the hypothalamus is very dependent on dopamine to have the hypothalamus do its job. One of its jobs is to tell your pituitary to make a hormone called TSH to tell your thyroid to turn on. So if we have low dopamine in our body, we get low hypothalamus activity, which means decreased TSH from the pituitary, which leads to one of the causes of low thyroid activity. So some common causes for dopamine deficiency. And by the way, dopamine it's the feel-good neurotransmitter. It helps us, motivates us, helps us feel good about ourselves. And when we have dopamine deficiency, it can be from things like poor methylation. A fancy word for that's a genetic change in your body where you don't metabolize your B vitamins the way that they should. You can go really in depth on that's the basics. You don't convert your B vitamins in a way that your body can use. Also can be due to hyper and hypoglycemia or insulin resistance. This blood sugar is going to affect how dopamine gets into the brain. It's going to affect how dopamine is formed. The big one too, this is so commonly in our society, is poor gut, poor malabsorption, poor gut function. You need things like amino acid called tyrosine. You need B9, B12, iron, magnesium, all to be combined together to make dopamine. And if you can't absorb them from your food supply, you're going to have dopamine production issues. Another common reason for dopamine deficiency is caffeine, excessive caffeine intake. Caffeine stimulates your adrenals, and your adrenals create chemicals called catecholamines, which require dopamine to be made. So if you are doing a lot of stimulants like caffeine or energy drinks or living a high-stress lifestyle, welcome to the 21st century. We are more stressed than we can imagine. That causes adrenal stress, increased catecholamines, and it starts to pull down the dopamine in our body. Last is things like alcohol and smoking, which will deplete our B vitamins. So some common symptoms we see of dopamine deficiency in combination with poor thyroid function is if a person has things like depression, or poor ability to handle their stresses, or mood swings, or poor concentration. Dopamine is part of that ability to focus in and do something, which also leads to things like forgetfulness or inability to start or finish tasks. Or can dopamine deficiency be part of ADD and ADHD? It can also be a part of addictions where you're looking for things to give you a thrill, to give you a dopamine rush, to help you feel good about yourself. So if you see those in combination with somebody who has some of the common thyroid symptoms, we start to ask questions of, does this person need wellness support in other areas of their body to improve that thyroid function? So thanks for watching this video, and this is Dr. Burke Mays. We'll talk to you soon in the next video. Thanks a lot for watching.